Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, we're going to be speaking with Primo Castro. He's joining us here as American Cancer Society Cancer Action Network advocate to speak out and to share his story and what his home state's doing through legislative efforts to help to sort of expand access to specialized cancer care for patients on Medi-Cal, as his mom had been. Welcome to Health Professional Radio, Primo Castro. Thank you for joining us this evening.
Thank you very much for having me.
Briefly tell us a bit about yourself.
Let's see. I am, a young 42 years old, father of four. I've been a cancer care advocate for the last nearly 7 years with the American Cancer Society Cancer Action Network. But also, it's part of the reason why, the biggest reason why I got involved in the cancer space, just because of my personal story, the way that it affected my family, and how it affects countless others. So I know that we're not a unique story, but hoping that my story can actually help benefit and shape policy here in California.
Now, it's my understanding that your mother was on Medi-Cal. What was your mother's medical condition at the time that she was on Medi-Cal, and how did that impact you and your family's life?
It was kind of an interesting way around how we found out that she actually had cancer. She had been misdiagnosed several times early on. She started with different aches in her abdomen, and then it just started spreading to different parts, even to the point where she actually had what it appeared to be jaundice, yellowing of the skin. So, after going to several, medical professionals and being misdiagnosed, it wasn't until the last one that the doctor was like, hey, you know what? We're seeing high elevation numbers on your blood count. Let's, we feel that it's this. Sure enough, she was diagnosed with gallbladder cancer, which is a very rare form of cancer. And, it was very, we didn't know what to think of it. We didn't know anybody in the family who had ever been diagnosed with cancer. Let alone, we've had some issues of diabetes, some heart issues, but nothing this significant, nothing this major. My family, obviously, I'm the oldest of four. My younger siblings were distraught. My father was a mess, didn't know exactly what to do. And somebody needed to go ahead and take the lead charge in making sure that my mother was going through treatment. And all the other stuff that comes with it. So, for somebody who was, 23, going to be 23 at the time, it was a lot, for me to handle.
Talk about the experience caring for your mom and some of the challenges that not only you faced, but that she faced, especially when trying to access the best care possible.
It's so as mentioned, my mother was to be honest, we were all raised under Medi-Cal, which is the national Medicaid program here in this country, and the reality is that we didn't know it at the time, but Medi-Cal patients unfortunately don't have the same access to the latest treatments. Don't have access to the latest drugs, to the clinical trials, and especially when it comes to an NCI designated cancer center. So, for me, having to go through this experience was very heart-wrenching. I was a young professional starting my career. I was actually working with the California Secretary of State at the time. So, I did have a little bit of that advocacy in me already, but when you're young and you're going right, through the emotions, through the up and downs, and through the pains, and trying to be a caretaker for your mother, it's very different, right? There's no handbook, there's no manual that says, hey, you have this, these are the steps that you have to follow. I think the worst thing of all is that, when my mother was diagnosed, at the hospital, the oncologist came over to me, my father. Obviously, I was translating over to my father, which yet another barrier, right? Especially for Spanish speakers. Mm-hmm. And, the doctor's telling me that, there is, this is your mom, she has gallbladder cancer. We could go ahead and go with the traditional route with the chemo radiation treatments, just like any other cancer patient does. But he did say one thing, right, that really stood out, even to this day, almost 20 years later, right? Mm-hmm. There's a clinical trial that this cancer center has, but unfortunately, your mother meets all, she meets all the requirements, but unfortunately, she's not able to, get into the clinical trial because she has Medi-Cal, and this cancer center does not have a contract or an MOU with that institution. So you could imagine, right? I mean, we're already crying. Everybody, my siblings don't, have an idea. They're younger. They're way younger than I am and stuff. So they're trying to take in the information, but they're crying. It's a hot mess. I'm trying to describe it, trying to explain it, trying to translate it, to my father, who's obviously, limited. English proficiency is very limited, as I said. So, very difficult to take that, that news in, right? And I think part of it is, the one thought that, that came to my mind is like, what good is it to have the latest treatments out there, all this information available, if individuals with Medi-Cal can't even access it? What good is it then?
What do you want people to know about the work being done as part of the Cancer Care is Different Coalition? And then talk a little bit about how you think the California Cancer Care Equity Act, or SB 987, will impact the lives of people, particularly from historically underserved communities.
Absolutely. This bill actually has the potential to not only service, but also provide a lot of meaningful targeted treatments for, not just for disadvantaged communities, but also those that live in the rural communities in California. We know that sometimes people travel up to 50, 75, even 100 miles just to get to, to some of the better treatment out there. And, this actually gives individuals an opportunity to seek treatment as they see fit, to an NCI designated center. This is huge, in a time when, there's a big push, for a better healthcare system. I think that, this goes in that direction about giving everybody under Medi-Cal, which is actually a substantial number here in California, the opportunity. While not everybody in Medi-Cal, obviously is going to go through a cancer diagnosis, it is going to give those individuals that are diagnosed with cancer, that the ability to seek treatment, somewhere where they feel that is going to render, that has additional resources and other treatment options, as opposed to just radiation and chemo. This is a broad coalition. And the one thing about it, that this is a coalition made up of a lot of stakeholders. So we're hoping that people see this as an opportunity to provide countless individuals, countless families, and to be honest with you, I just don't want to see more families go through the same pain and heartache and shed tears because of a loved one that couldn't access the latest treatments or the clinical trials available out there.
Give us a website where we can learn more, if you would, Primo.
Yeah, absolutely. www.cancercaredifff.org or cancercaredifferent.org. Once again, it's www.cancercaredifff.org.
Primo, it's been a pleasure speaking with you. Thank you so much for joining us here and sharing your story on Health Professional Radio.
Thank you very much, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Primo Castro. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.